Today we are going to talk about internship in public health informatics and technology program. We'd like to say that from September last year to April this year, we had 147 individuals took hybrid training on public health informatics and technology using our portal PHITusa.com. The platform contains data sets, algorithm, quizzes, hands-on training, capstone projects. They have direct access to various databases, different platform registries, and so forth. Besides that, we had bi-weekly online meetings to answer questions and provide additional training. This online training platform has various options, and it represents a one-stop shop for training because when you do it without platform, that students sometimes spend up to 80% going around and try to find out different algorithm, Python codes, and everything. So they can find everything that is pertinent to the training in public health informatics and technology, both for beginners, for working professionals, for other individuals who would like to advance their careers, would like to get hands-on different public health real world data, big data using different platforms, for example, Hadoop, Spark, and so forth. So this platform has direct access to various platforms, the different algorithms, Python training, and hands-on training capstone projects. So we had, as I said, in 1 year, 147 students who use this platform together with our training online. So it is hybrid training in public health informatics and technology. And it is surprisingly, we had only 31 people we put on internship out of 147. So this number is very, very low. And we would like to focus this year starting from the fall 2024, ending in the spring. We try to focus on internship because we found out that internship represents a quite important element in complete training in public health informatics and technology. And why it is so low in 30? It's only 31 we put on internship in 1 year. And this is the question that I would like to explain why this number is quite low, because the preparatory phase for internship is very lengthy and it is time consuming. For instance, we had to sign contracts with the companies, organizations that take our students for internship. Plus, it is also time consuming that we had to discuss the projects. And this discussion project back and forth, it took a lot of time because we had to agree upon what actually they're going to work on, because organizations are quite leery to take people to work if they, for instance, their education does not match what actually the organization needs are. But the most important why it is that feature, why we had this low number, because we try to select out of all this organization who wanted to take our students in internship, those who have potential to hire our students after internship ends. And we found out that organizations are quite uneasy to make any commitments, because what happens that some of them, they complain that they take graduates who knows some fundamentals, but when they come, they have no idea how to work with the real world data sets, how to process, how to pre-process the data, how to invoke maximum information from the data sets, how to build information systems, and even simple thing like to move data from point A to point B that makes graduates admission is quite hard. So they have some problems to do simple things, and this of course makes that organization, they are quite not so easy to make any commitments about placement. And we would like that that the person goes on internship, and that this person will be hired. So that is what our objective was. Otherwise, this number would be much higher than 31, because actually we placed almost all of them to work after internship. Okay, so let us talk about some statistics. Out of 31 students who participate in internship during 1 year, we had 18 Afro-Americans, we had 7 Hispanics, Latinos, and we had 6 white Caucasians. That is the racial split. Now, what happens is that this final, the chart shows organizations who took the students for internship after painstaking discussions about what they're going to do, how they're going to do, how this organization, and how to organize logistics and so forth. So we had 4 hospitals, and I will just tell a few words later on what actually this task that the hospital they gave, because we try to focus on working with registry. So these hospitals where it's public health, informatics and technology related. Then we had maximum, so we had 7. It is internship in public health agencies. I will also talk a little bit later about that. We had also organizations that are working on environment and try to match their problems with public health, the environmental agencies. We had nonprofits also who are doing some work on public health informatics. We have social determinant of health, as we say, we had 4. And also, I'll tell a few words later on about this task that they were doing, working with organizations like Social Determinant of Health. And we had 2 students who worked with IT companies on software development, and these companies actually were doing work for public health organizations. So I could say that all organizations that we have chosen and we place students to work, so all of them, the work was very much focused on problems related to public health. Now, what's the timeline? The participants worked for 8 weeks, so it is 8-week program, 35 hours per week, totaling 280 hours. Okay, so that is how it works. And we had 3 modalities. The first one is remote. Then we have hybrid and in-person. So hybrid and in-person, of course, were most more attractive than just remote working. And this is quite understandable. Now, let's talk about topics for internship. And this took lots of time, as I said before, because we had to be absolutely sure that our students, they do work related to public health informatics. And after that, we just, they would demonstrate the skills that they learned, fundamentals, that is rigorous training in working with real public health data, doing work on information systems and so forth. and that is all the skills to be used. That is, we would like to that the company would appreciate, and of course, after that, hire the students to work for the companies. So, what is the environmental agencies? They were quite interested in data integration. Data integration is one of the pillars of modern public health informatics and technology. And our students had training how to make this integration mostly efficient. And for instance, we had one project, it is air pollution. And air pollution, as we know, it is linked with infectious diseases. So air pollution can increase exposure to microbial airborne pathogens, and it can exacerbate human susceptibility to infectious diseases and worsen disease severity. So this is quite important, and we had students working in this for this in the organizations of environmental organizations, both state and local. So this is air pollution. Another thing that environmental agencies were interested also that our students do data analytics and data integration of public health and wastewater. So wastewater surveillance is commonly called wastewater-based epidemiology, WB, and is also referred to as wastewater monitoring or wastewater surveillance. So this internship project is focused on analytic tools development and the analysis of extensive data sets obtained from diverse wastewater facilities and sewage conditions. So that is quite important, and we had the data from wastewater surveillance and also the pandemics, including COVID-19. So that is what our students worked with the environmental company that they were working for. We had quite important work with social determinant of health and working with AHRQ databases. We found out that these databases, they had tremendous wealth of information, various information, and of course should be used more extensively, I would say that. And we had two students that worked on that, and they did analysis of AHRQ databases that include information on race, ethnicity, household income, population density, homelessness, education, food insecurity, urban rural location of residence, insurance, crime, transportation, etc. We had lots of features where we start, for example, to put the data in the let's say database, data warehouse, or even data lakes when we try to do integration of data. So what happened is that it depends, of course, on the problem, but we also taught our students, and they use it in internship, to use feature engineering. So feature engineering is very important because feature engineering shows what feature is important, what feature can be dropped. Okay, and they use, of course, a random forest for doing this kind of analysis, and they found out which problems that satisfy a certain number of features and which features are important for each problem that, for instance, SDOH organizations are interested at this time, at this phase. Okay, so that is what our students were working, using data analytics with feature engineering with random forest. So that was another thing that we had companies, and these mostly companies that were companies like hospitals, clinics. We had these companies that are quite interested in the use of FHIR API, RESTful API, yeah, for data interoperability and using data exchange with of EHR. So instead of ETL or ELT, using this kind of fast health interoperability with RESTful application programming interfaces. And our students had very rigorous training using this platform, because this platform has the FHIR server. So they use how to bring the data from one place, how to extract the data, and how to store the data, for example, in MongoDB, in the cloud repositories, and so forth. So that was working for medical, and we had also more requests to have students with this knowledge, because we understand, of course, that HL7, V2, V3, which is, of course, wonderful and used for many, many years, although it is quite old protocol. Nowadays is quite slow and is not as efficient as a new protocol FHIR with supported by RESTful API. So that is what this kind of work is in great demand now. And our students, as I said, they get this kind of rigorous education, and they are quite welcome by various organizations, specifically hospitals, clinics, public health agencies. Now we had a project on health equity and disparity, and we use the data from the Office of Minority Health. It's OMH famous. And OMH includes sourcing and maintaining a body of expert knowledge on minority health status, initiatives, demographic statistic, analysis of minority population compiled by the National Center for Health Statistics and Census Bureau, private foundations, clinical practitioners, private data sources, public agencies. The data sets were used for classification regression using machine learning. So that is basically the use of health equity and disparity. We had students with solid training in machine learning. It can be polynomial or linear regression, logistic regression for classification, support vector machines, decision support systems, and so forth. And there is lots of work, and there is also quite important demand, quite vast demand in studying that health equity and disparity using informatics and technology algorithms, and specifically from non-profit organizations. So we have this, we established quite good relations, and for next year, they will take more students. So we think that we will have more than 31, of course, next year. And we try also to learn on our how to make this process more efficient. So because, as I said before, we spend a lot of time for discussion, sending documents back and forth, and therefore we didn't have many students as we could have. So only 31. Now, what, as I said, that one of the important measures, important criteria when we chosen the organizations to be working with us on internship, we would like that they have potential to hire. And as I said, they're quite uneasy to make any commitments prior to that. And this was quite a thing that stifled actually our move towards internship. And what happened is that this is a result of our work on internship with the companies. So we had 7 students hired by public health agencies, state basically. Then we had 5 students were hired by environmental agencies. Then we had the 5 also students hired by social determinant of health organization. We had 6 the non-profits. They hired our students. We had hospitals. We had third students that they started working right away on data exchange, specifically using new protocols, FHIR API, and we had number 6, it is IT companies. We had 2 students were hired to continue working on software development because, as I said, we gave the students quite solid knowledge on Python programming, specifically working with public health data under big data postulates using open source platforms like Hadoop, Spark, and migration to public health data lake houses. So that was the idea for now. So we placed on internship 31, and 28 students were hired, and 3 now undergoing different interviews. So we believe they will be hired within next weeks. All right, thank you.